Hi, my name is Dr. Ian Bulow, and I'm from Pittsburgh, Pennsylvania. And I've been given just 5 minutes to tell you something that may very well save your life, or the life of someone that you care about. So if you'll spend just a few minutes of your time with me, I promise you that I will tell you nothing but the truth. You might enjoy it and you might appreciate the information, and then again, you might not. It might make perfect sense to you, and then again, it might fly in the face of everything that you've learned. But I promise you that my commitment to you is that it will be 100% truth. So my job today is to tell you about this thing called chiropractic. And you know what the truth is? The truth is that right now, what's going through most people's minds is the image of someone having their neck cracked or back twisted and popped. Or perhaps you know somebody, or you yourself have been helped with the alleviation of something like neck pain or back pain. But can I tell you the truth? The truth is that chiropractic is no more a treatment for neck and back pain than heart surgery is a treatment for chest pain and arm pain. Let me explain that. A heart surgeon goes into the chest cavity and opens up the chest and performs radical heart surgery. Not because the chest hurts or the arm hurts. That's got nothing to do with it. They perform heart surgery because the arteries that supply blood to the rest of your body are choked off. And the heart cannot get that blood through to the rest of the body. And that's a dire situation that needs to be corrected. Does that make sense? In the same way, chiropractors look at misalignments of the spine, what we call subluxations. Not because the tissue or muscles around the spine are hurting. They might hurt, they might not. We do that because if the bones of the spine misalign, they close the openings through which your brain communicates with the rest of your body. If the openings of your spine close down, they damage the nerve tissue. The same way, if the arteries of your heart close down, they damage the blood tissue. Can you see how that might be important? If somebody breaks their neck, very often they die because they sever the communication between your brain and the rest of your body. What if we break our neck lower down? If we break some parts of our back, we might not die, but we might be completely paralyzed, because the reason is that if the brain cannot communicate with any one part of the body, that part of the body will suffer. It doesn't matter if you have pain or not. If we cut the nerve or agitate the nerve, diminishing the communication between our brain and that part of the body, it will suffer. So wouldn't you want to know? Wouldn't you want to know if the messages are going through the spine out to the tissues the way they're designed? How would you know? Let's go back to the analogy of a heart. How would you know if you have a problem like high blood pressure? How would you test to see if the heart is functioning appropriately? You get it checked. When would you get it checked? Do you wait for a heart attack in order to go to the cardiologist to have your heart evaluated? I would hope not. In fact, most people check the integrity of the heart from the day they're born. Think about that. When your baby is born, when a newborn baby is born, what's the first thing they do? They take the baby over and they listen with a stethoscope to the heart. Not because the baby is having chest pain or arm pain, but because the heart is a vital organ to the survival of that newborn life. Well, can I suggest to you that from day one we should be checking the integrity of the spine? Not because we have pain in the spine, but because we have to make sure there is no pressure on the delicate nerve tissue sending signals from the brain to the rest of the body. So who would do that for you? Chiropractors. They're the only doctors on the planet, the only ones on the planet that are concerned with the relationship of the vertebra, the backbones, and their impact on the delicate, sensitive nerve tissue communicating signals from your brain to the rest of your body. They're the only ones. They're the only licensed doctors to be able to do that. So can I challenge you, if you have never had your spine evaluated for vertebral subluxations, for misalignments agitating the nerve tissue, that you do that and do it right away? If that makes sense to you, I would challenge you to look for a licensed chiropractor. And if you don't know one, I want you to contact me. You can email me directly at drbulow@gmail.com, or you can call my cell phone, 724-553-8526. I don't care where you live. I don't care what your problems are, or maybe you have no problems at all. I will find you someone to take care of you and your family, if this makes sense to you. I told you it'd be nothing but the truth. I hope you've been listening. God bless.